All right, so Stephanie here. I am going to go over the 6 components of a complete doctor's order. I've been a nurse since 2007, been teaching since 2013. I have a private school here in Massachusetts, and I've been director of health services. So let's get back to it. I am in Massachusetts. I'm going to help people pass the medication administration program, the MAP exam. Some states call it Meditech. And so check your regulations to see if a few subtle things might be off, but the main concepts are pretty much standardized, okay? But I just wanted to provide you with context that this is in regards to the state of Massachusetts. So what I want to go over is the 6 components, right? Which is the core of everything. This is the 6 components to a complete doctor's order. You're not transcribing, you're not administering, you're not doing any of that if you don't have the components to the doctor's order, okay? And so we want to go over it. How do you know when it's complete? So right here, step 1, the first component is the patient name. We have first and last name here. So this doctor is writing for John Smith. The second, number 2 here, is the med name, is Tylenol. Now, when you think of it here, you want to think of both brand and generic, and I have another video going over that. Every medication has 2 names, and when you look at the medication grid, you have a chart where you have to fill that in. Now, the doctor is not obligated to write both names here. They've just written down Tylenol. You are not a pharmacist. You're not going to have every single medication that's ever made, both brand and generic names in your mind, right? That's unrealistic. So you have a chart where you will look that up. The third here is dose, okay? And if you have not seen my video on dose equals strength times amount, definitely go through and check that out. This is what the doctor wants the patient to get in what amount. John Smith is to receive Tylenol at a dose of 100 milligrams. All right, so you don't just write 100, you have to write mg or ml or whatever it is. And this right here, number 4, this is frequency. All right, frequency is how often. They want him to get it daily, twice a day, 3 times a day. You can't have a med and not know how often is to be given. And this by mouth, number 5, is the route. By mouth is a pill or a capsule, tablet that the person is going to take by mouth, okay? If it's liquid, it would be elixir. So let's take a pause here because it's very important for you to understand, because this will be your 5 rights of medication administration. When you're reading off and doing your 5 rights to pass out meds, you're checking that all of these are correct. Right patient, right med. Let me just put med, even though I have brand and generic. The 5 rights are right patient, right medication, right dose, right frequency, and right route. Right medication, right patient, right medication, dose, right frequency, and right route. Those are your 5 rights. Now you could see here, I said, well, what's the 6 components of a complete doctor order? I am a registered nurse. I'm not a prescriber. So if I wrote this down, you can't go around start administering it. The doctor, let's say Dr. Alicia Johnson, after she writes this, she then has to sign her signature. Alicia Johnson, this is made up. I don't know if there's an Alicia Johnson out there, MD, okay? And so I went over the MAP consultant video on who could prescribe. Here in the state of Massachusetts, prescribers, which mean doctors or people who are able to write orders, is MD, medical doctor, PA, physician assistant, NP, nurse practitioner. You also have DMD, all right, so dentist. So you have to make sure you understand who is able to sign this. And so it is complete if you have the 5 rights, and the 6th component is that the person who signed it, one, that is signed, so you can't administer or transcribe anything that's not signed, but 2, that is signed by someone with the appropriate credentials, okay? So I hope that this helps. This is the core for you to understand and begin to understand MedPass and transcription. So please like and subscribe. Check the link. I have practice questions and we'll go from there. All right. Take care. Bye.